Hello and welcome. I'm going to present some preliminary findings on a study I'm doing together with my colleagues, Dr. Elizabeth Arkema and Dr. Susanna Kulbari, on the relation between sarcoidosis and immune-mediated, or otherwise called autoimmune diseases. Let me first introduce myself. I'm Arios Rossides. I'm a resident in respiratory medicine at the pulmonary clinic at Karolinska University Hospital. I did my PhD on clinical epidemiology with a focus on sarcoidosis at Karolinska. I also have a master's degree in epidemiology and public health from the same university. Before we delve into the relation of sarcoidosis with other autoimmune diseases and why it is of interest, let's define autoimmune diseases. Auto pertains to self, and immune refers to the involvement of the immune system. So that an autoimmune disease is a state or condition in which the immune system mistakenly attacks the body's own cells and tissues, and that leads to inflammation and therefore damage. The etiology of autoimmune diseases involves several components, of which genetics or heredity is an important factor in most of these diseases. Lifestyle factors, hormones, and environmental factors or triggers have also been recognized in this disease group. Diseases may be more organ-specific or diffuse, affecting a range of tissues or organ systems. Multiple sclerosis, as shown in this picture, affects the central nervous system, while systemic lupus erythematosus, another autoimmune disease, affects several different organs or tissues in the body. Some of these diseases are extremely rare, and others occur in more than 1 in 10 individuals. Age and sex are very well-known risk factors for many of those. Symptoms usually originate from the inflamed or damaged tissue. Examples here include the skin with different types of rashes, the lungs with scarring or otherwise known as fibrosis, or destruction of the joint components leading to inflammation and pain in rheumatoid arthritis. Autoimmune diseases have several features in common that this is worth looking at. There's usually loss of tolerance to body tissues and cells, and that leads to the production of antibodies or autoreactive T cells that attack these antigens, this type of cells and tissues in the body. There's usually a persistent inflammatory response that leads to tissue damage and dysfunction. There's usually a recognized genetic predisposition in these diseases, and they're usually triggered by an environmental factor. There's quite a lot of heterogeneity in the presentation of these diseases and the disease course. Another important feature, which is of relevance here, is the overlap between different diseases. That is, disease presentation of autoantibodies and other mechanisms of two otherwise entirely different disease entities are identified in the same individual, either concomitantly or at different points during the disease course. But what about sarcoidosis? Overlap is of great interest in sarcoidosis, a systemic inflammatory disease which shares many of the features of other autoimmune diseases but is not recognized or classified as such. Several observations suggest that there is significant overlap, or let's call it co-occurrence, of sarcoidosis and several other autoimmune diseases. These findings come from clinical experience. We identify patients with detectable levels of autoantibodies associated with autoimmune diseases during the workup for sarcoidosis, And there's data in the literature suggesting that individuals with sarcoidosis have more commonly another autoimmune disease at the time of diagnosis. Talking about autoantibodies, here's a table presenting findings from different and previous studies from different countries, showing the prevalence of autoantibodies at the time of diagnosis in individuals with sarcoidosis, and this are autoantibodies related to several different diseases, including diseases of the joints, the connective tissue, and the thyroid. Sometimes the prevalence, as you see in the fourth column here, comes up to 30 to 40%. Given this background on the potential overlap between sarcoidosis and autoimmune diseases, we designed a study aiming to examine whether a history of autoimmune disease is more common in sarcoidosis compared to the general population, and not limited to that, to study whether a history of autoimmune diseases is more common in relatives of patients with sarcoidosis compared to relatives of individuals without sarcoidosis. That is, more common than one would expect by chance. To clarify, finding a higher probability of a history of autoimmune disease in a patient with sarcoidosis would mean a potential overlap in symptoms and signs of sarcoidosis and autoimmune diseases, which is relevant for diagnostics and the treatment of different diseases and sarcoidosis, and say something about the potential mechanisms among diseases. A higher probability, however, of autoimmune diseases in the relatives would mean a shared cause or causes, probably referring to shared genetic factors. Now back to our study, and thanks to the Swedish registers that all of you provide data to, we could identify individuals with sarcoidosis that were diagnosed in hospitals all around Sweden between the years 2001 and 2020 and their relatives. We could identify individuals without sarcoidosis from the general population and also identify their relatives. Identify diagnosis of autoimmune diseases made in Swedish hospitals. In all of them, individuals with sarcoidosis, those without sarcoidosis, that is comparators from the general population, and all of their relatives. We analyzed this data using robust methods that I'm not going to get into detail, and that is to exclude that our findings were due to chance. Let's get to the results. I should mention that these are just preliminary findings. They are not peer-reviewed or published yet, and they should be interpreted, therefore, with caution and not be shared as of yet. In this study, we included about 14,000 patients with sarcoidosis and about 118,000 individuals from the general population without sarcoidosis. The average age in that population was about 51 years old. 42% of these individuals were females, and we also identified their first-degree relatives, and that is their parents, their siblings, and their children, and that amounted to 73,000 in the sarcoidosis population and more than 600,000 relatives of individuals from the general population without sarcoidosis. Moving on to the main findings, this is a graph showing you the percentage of individuals with sarcoidosis in teal-colored bars, and those without sarcoidosis in gray-colored bars that have a history of a range of different autoimmune diseases ranked by commonality from top to bottom. For example, diabetes mellitus type 1, the most common, to individuals with celiac and Addison's disease. We should mention that these diseases here are grouped due to small numbers to allow for further analysis, which we're gonna see in the next slide. To your right, numbers indicate how much higher the probability of having a history of these diseases is in patients with sarcoidosis compared to the general population. Taking the example of diabetes type 1, we observe a 2 times higher, or more specific 1.95 times higher probability in sarcoidosis compared to the general population. If we look now more carefully into those groups and rank these diseases by how much more common they are in sarcoidosis than in the general population, we find that myositis, otherwise known as muscle inflammation, and vasculitis, blood vessel inflammation, rank at the top. They're almost 4 times more common. They're followed by Sjogren's syndrome, gland inflammation, celiac disease, otherwise known as gluten intolerance, and systemic lupus erythematosus. We should note, however, that as shown in the previous graph, some of these diseases are quite rare. For example, myositis here is 4 times more common, but that's starting from a very low baseline probability of occurrence. Now to part 2 of the study, in which we looked at autoimmune diseases in first-degree relatives of patients with sarcoidosis compared to individuals without sarcoidosis from the general population. Using here sarcoidosis as a benchmark, we appreciate that having a relative with sarcoidosis leads to a 3.5 times higher chance of getting the disease yourself. That is true for all autoimmune diseases at various rates, ranging from 1.3 times, here for example for diabetes, to 2 times higher chances here for example in celiac disease. Having relatives with these diseases gives you a higher chance of getting sarcoidosis yourself. To sum up this short presentation and preliminary findings, individuals with sarcoidosis are more likely to have another autoimmune disease at the time of diagnosis. Of these diseases, myositis, inflammation of the muscle, vasculitis, inflammation of the blood vessels, celiac disease, and lupus are among the diseases that occur more commonly in sarcoidosis than one would expect by chance. And sarcoidosis and autoimmune diseases cluster in families, suggesting shared mechanisms between autoimmunity, immune-mediated diseases, and sarcoidosis. Thank you very much for your attention.